I'm Oswin Baker. I'm head of Rockpool Research Associates. We're a new network of researchers, analysts, social market experts, in particular dealing with issues around public health. And I'm not sure if I can come up with another model for you, I'm afraid, Jeff.
No,
but
I'll tell you what model you have later. Don't worry.
Okay. I find myself sort of today at the centre of a case study and best practice perfect storm. I mean, today has been about and should have been about finding new ways of doing public health, of promoting public health, of making public health programs, initiatives and interventions effective and successful. And I think that's a really important message for everybody to be taking away. I think there's another important message which in many ways gets lost in our current public health discourse. But it is, I couldn't bring a real elephant, I'm afraid, but it is in many ways the elephant in the room. And that is that for the local authority people here, and I go up and down the country and work with local authorities, taking over public health is at times quite a scary idea. It is something which most local authorities haven't really dealt with for most of my lifetime. And really a lot of the councils who I've been working with, they're saying, well, how do we do this? I mean, there's some of this we know about, but a lot of this is outside our comfort zones. Does this mean we're going to have to start from scratch? Are we going to have to, people I know have talked earlier about trying not to reinvent the wheel, but are we going to have to reinvent the wheel to do this? And I think part of the problem is the very term that we're lumbered with. Is it public or is it health? It's been health for most of the last 40 years, but in 18 months, it's going to be public. And I think that that points to a cultural schism, perhaps, in the way that we view public health. My background, I've spent most of my life working around the healthcare area. But I was speaking to somebody from a local authority the other day, and obviously this is their perspective, but they felt that the NHS, when you're talking about public health, it very much has a treatment mode. It is treating people, whereas local authorities serve people. Now, there are some things that you can agree and disagree with that, but I think that broadly it does point up a truth that the NHS, when it's looking at public health, has a very medical, very scientific, very evidence-based view, and it has to be. Smoking kills, smoking is bad for you, you have to stop smoking, this is what we're going to do to stop people smoking. I think local authorities, though, with their fingers in so many more pies, I don't mean that in terms of envelopes full of money or anything, but doing so many more things, they have to, of necessity, take a much more politically nuanced view. I suppose when I'm saying politically nuanced, if you're, as a local authority, if your cabinet member for public health is a fat smoker who's up for re-election next year, really you can kiss goodbye to any work in public health for that period. So there is that cultural issue that they need to face. And so the local authorities are now faced over the next 18 months or so with working out, well, you know, there's the logistics of it. What are we going to do with all these fantastic public health professionals who are coming into our patch? Can we physically accommodate them? Physically, literally, where does the Director of Public Health sit? And then you've got the politics of where the Director of Public Health sits. And you've got the politics of how we can make health and well-being boards strategically take public health and run with it in an effective way. So there's a lot of issues there which I think for many councils can be a bit daunting. As I said, I don't think they necessarily do need to reinvent the wheel. And Jeff said to me earlier that actually a lot of public health stuff isn't rocket science. So here's a boy making a rocket. The key message which I would say to councils, and how many people here are from councils? Can you put your hands up? Oh, okay, good. The key message I would say is that it isn't really about old dogs and new tricks. It isn't about councils needing to learn a new public health language. I've been doing some work with the local government group, used to be the LGA, with 25 councils up and down the country looking at tobacco control. And when these councils first started out doing this, yeah, there were some bits of tobacco control they could cover off. They could do illicits. They could do trading standards. They could enforce smoke-free legislation. when it comes to smoking cessation, when it comes to behavioural change, when it came to going to schools to talk about tobacco control, these were things which they were less comfortable about. The thing that I found really reassuring about this process was that by the end of it, these were things where they had developed that comfort zone. And I think that really the lesson from that piece of work for me was that councils had to take on board that there were things that they could do and knew how to do them better than anyone else, and that was the starting point. It's about finding a simple, understandable entry point for local government. And if there are things that they don't know how to do, the one thing that local authorities do probably better than most other people, whether that's in the public sector or the private sector, is work in partnership. Local authorities have to work in partnership really to get anything done. And the things that these local authorities did when they were faced with having to tackle tobacco control is they made their partnerships work for them. Now, that didn't mean that they then said, well, we don't know anything about smoking cessation, you go and do that. You're the NHS, we'll give that to you. They brought the partners in to help the local authorities expand their comfort zones. So it is about starting with what a local authority knows how to do and the things it doesn't know how to do, working with the partners to do that. I said today's is sort of a case study tsunami. I'm going to give you a couple of little ones here. Really concrete examples of how local authorities and how councils can make public health work for them. Something which a lot of the local authorities that I've been working with on this, they've been saying, housing is, it is this huge opportunity. We literally have everybody sitting there and we should be able to do something with them. But how do we go in there, especially if the councils aren't controlling the housing stock anymore? And really the way that councils have been doing something around this is they start off with something small, start off with something tangible, start off with smoke alarm tests. Fire service will bite your arm off for this. This is something that they need to do and want to do. And if you're able as a local authority to work with the fire service and to work with the housing providers, that's a way of getting an issue around smoking and public health issue into the arena of housing. From that, you could then start rolling off from that, in particular if you get the tenants to persuade their landlords that they want more smoke-free information, the people who do the smoke alarm tests, bring in leaflets, smoke-free families leaflets, all the collateral and stuff, and from that you can roll on to actually doing some further proactive programs about trying to get people to stop smoking. A key thing here is, well, what's in it for the housing providers? What's in it for the housing providers is money. I was speaking to the housing provider in Islington, and they said that what had pricked up their ears on this was they suddenly realised the redecoration costs. How much it costs for them to paint the yellow ceilings, to replace the carpet with all the burns in it, all the furniture with fag burns in them. For them, they realised that there was actually an economic argument here as well as a sort of a corporate social responsibility one. And building on the stuff that Vernon has just talked to you about in terms of planning, we work with Tower Hamlets, and we work with them, and the council was very keen to see what they could bring new to the party. A lot of stuff around obesity, the NHS and public health can deal with. But what could the council bring? And what they could bring was planning. Because nobody else does planning. It's a thing that the council does. And we work with them through this, starting off looking at what their planning policies were, reviewing the evidence, which is crucial because you'll get taken to court by KFC, develop a suite of policy options, take them out to the public, and also then from on that you can look at what other environmental assets does a council have in terms of public health and in terms of obesity, green space, parks and things. You can look at in terms of the money again, going back to the community infrastructure levy. And we work with them to develop this suite of policies where they can now challenge future applications for fast food takeaways. Sounds like a small thing, but it's about reducing the supply as well as reducing the demand. And NICE say that you can make significant cost savings from this. So again, on this one, there's money too. Last point then. To take anything away from this as a local authority, the key thing is to embed any work that you're going to be doing around public health. It's very difficult, of course, in these particular straitened times. But if you can use the community, if you can use the tenants to persuade the housing provider, if you can work with schools, if you can find ways of investing, whether it's in people or whether it's in resources, stockpile leaflets. As soon as you can do that, then you're in a position where public health can be integrated into a local authority's work without scaring the horses. And ultimately, I suppose, something else which hasn't really been mentioned today, it puts a local authority at the forefront of a real physical manifestation of the localism agenda. Thank you.